Hello everyone, it's me Andrew, welcome back to my channel. So today I got a copy letter that the g.i.c has written to Dr. Yelland, and I got it today, and one of the amazing things is that I got it 2 months after my appointment. Usually it's like, it takes about 3 months to get like a copy letter or just a letter from my g.i.c, but 2 months is amazing because like the doctor I saw from the last appointment, she said they're trying to send post office like ASAP, so this is a really good job. It's just shaving off like another month, and that's like really cool and amazing. So I'll just read out what they've written to Dr. Yelland, and so it has my name, my date of birth, my address, my NHS number, and my phone number. And so they said the above named has fulfilled all the criteria of the gender identity clinic, and we would be grateful if you would now see him with regard to an opinion for provision of possible double mastectomy. Words I can't pronounce. With associated chest recontouring. Following discussions with surgical colleagues, it has been agreed that this referral is only valid for 12 months from this date, as indicated above, or sooner, or should the patient's circumstances change. And then it has signed off both my signatures from the doctor I saw from my last appointment, who is a psychologist, and my other doctor who prescribed me testosterone, who is also the lead clinician. I shouldn't have attempted to pronounce that. They also sent it to their referral teams, which is to themselves as well, and to my GP, my general practitioner. So this is really exciting. Oh my god, so this has to happen like within 12 months, and wow, cool. Oh my god. And then they sent this 2 double-sided letter to my GP, basically talking about the appointment, which I'll briefly read out, which is nice because that means my GP knows what's up and stuff like that. Even though I know some people's GPs don't bother reading letters, which is weird. I mean, I know that they have loads of patients, but usual, my name, date of birth, where I live, NHS number, appointment type, which is consultation, which was my top surgery appointment, treatment objective, surgical review, mastectomy and male chest reconstruction, and there's presenting issues and concerns. Trans man, brackets, natally assigned female seeking mastectomy, I hope I'm saying that right, I'm not butchering the word. And male chest reconstruction, Mr. Miguel, would also like genital reconstructive surgery, as he's very dysphoric around his genitalia. Today Miguel would like referral for, there's this word I can't pronounce, so I'm not going to bother, mastectomy and then male chest reconstruction. He is currently binding his chest most of the time when outside. His expectations of surgery seems realistic. Thank you. It would make him feel less self-conscious using male changing facilities, and he is dysphoric around his chest. Binding is very inconvenient as well. Dr. Miguel, wow, Mr. Miguel, I'm not a doctor. I said that again. Mr. Miguel would like genital surgery, as packing is exhausting. And it feels like something is missing. I do feel like that. His preferences words. If I can work the subtitles for this video, I'm gonna put it in the bottom here, where I'm gesturing. He has quite a lot of dysphoria around his genitalia. That's very true. And then talking about family history, because I mentioned my mum. Mr. Miguel's mother confirmed recently that she was never upset about my transition. Just concerned about others' potential reactions. She uses the right pronouns and calls him her son. Social history, talk about job here, and then they talk about my medical history, about medication, diagnosis, like I have depression, anxiety, I've had any previous surgeries, which I haven't, and then there were allergies, eggs. It's because if I eat too much eggs, my skin will flare up around my face, and it's so awful. It was loads of fun eating eggs, but the results of it was awful. And they talk about my mental health. They wrote here, good eye contact and report. Thank you. I'm like, cool eye contact. Yeah, nailed that one. I try to do this thing where I try to make, just to be stubborn with my anxiety and almost to spite myself in a way. Try to make eye contact with as much people as I can. Yeah, that's what I attempt to do. Just and then they talk about my summary and basically everything they've like written in here. And then, they talk about this care plan. 1. Mr. Miguel is now being referred for male chest reconstruction to his preferred surgeon, Dr. Yelland, with support of Dr. Barrett and myself, which is Dr. Barrett, the lead clinician, the one who prescribed me to tea, and the psychologist that I saw last time. Penny. I'm gonna just refer to her Penny. That's such a cute name. Number 2, surgical review, 60 minutes with Dr. James Brannett. And that is it. And then they signed it off, and then they also sent this letter to themselves, me, and to Dr. Yelland, and that is it. That is my top surgery update. I kind of almost love hearing what they write about me to my GP. In a way, it's almost really nice. I think the only kind of feedback I don't like is when it's from like interviews, like job interviews. That's probably like the only one that seems really scary. But this seems pretty chill and pretty nice, and it's got me more pumped and excited, and it's, even though it's a copy letter to Dr. Yellen telling him, please, you know, Andrew really likes to see you. With this letter, it's reassuring, it's more validating, because it means that hopefully I get to, I'm like a few steps closer to top surgery and to having it all happen, maybe, like before the end of 2017, and that's like really weird. Oh my god. I'm really excited about it. So many things have changed. Oh my god, it's just like, I mean, so much change has happened in the last 10 months, and I'm almost one person who's not really good with change and adjusting, but like with this, I think I've been doing pretty well, and it's just something that I've grown very natural about on regards to testosterone, because sometimes I like surprise myself sometimes every day when I'm like, oh yeah, I'm on testosterone, and it's just, it doesn't feel abnormal, it feels so natural, so it's just really cool. So that is that's my top surgery update. So oh my god, I'm hoping in future videos I get to show you my actual chest and like just show you how it is, like probably like when I do like a pre-op and then post-op pic or something. I'd like to do that just to show you, just basically just to show everyone, and hopefully in some way it be useful, and it will help with your expectations or something. Yes, so thank you very much for watching. I'll see you all in the next video. Bye! After it has this, hi Mum!